Hey everyone, welcome to Chemfree TV. Today, we're diving into an important topic that affects so many of us, especially women and young girls. Understanding your menstrual cycle. We'll cover how to track your menstrual cycle properly, why periods can be painful and how to relieve the pain, the best self-care tips during menstruation, how to know when you're ovulating. Understanding your cycle helps with your overall well-being and even fertility. Whether you're trying to conceive or just want to manage your health better, this video will provide everything you need to know. So stay tuned and let's get started. But before then, click on the like button and also subscribe if this is your first time with us. First, let's talk about how to track your menstrual cycle. Your cycle starts on the first day of your period and ends the day before your next period begins. While the average cycle is about 28 days, it can be anywhere from 21 to 35 days and still be normal. For example, if your period starts on March 5th and your next period begins on April 1st, your cycle length is 27 days. Tracking your cycle is important because it helps you predict your period, recognize irregularities, and identify ovulation windows. There are many ways to track your cycle. Using a period tracking app, a simple calendar, or even a journal. If you notice your cycle is frequently irregular, it might be a good idea to check with a doctor.
Now, let's talk about period pain. Also known as dysmenorrhea, most of us experience some level of pain during menstruation. But why does it happen? Period cramps happen due to the release of prostaglandins, a hormone which causes the uterus to contract and shed its lining. The higher the level of prostaglandins, the stronger the cramps. For most people, period pain is mild to moderate, but for others, it can be debilitating if your pain is so severe that it affects your daily activities. It could be a sign of an underlying condition like endometriosis, fibroids, or polycystic ovary syndrome. Here are signs that your period pain may not be normal. Severe pain that doesn't improve with painkillers. Pain lasting longer than 3 days. Heavy bleeding with large clots. Pain during sex or bowel movements.
If you experience any of these, I highly recommend speaking to a doctor to rule out any underlying conditions.
Let's talk about self-care during your period. Taking care of yourself can make a huge difference in how you feel. Here are some simple but effective ways to manage discomfort during this period. 1. Use a hot water bottle or heating pad on your lower abdomen to relax muscles. 2. Stay hydrated. Drink plenty of water to reduce bloating and fatigue. 3. Eat anti-inflammatory foods like leafy greens, nuts, and fish to reduce pain. 4. Reduce caffeine and salty foods, as they can make cramps worse. 5. Exercise lightly. Yoga and stretching can actually help relieve cramps. Actually, you might be thinking, exercise while on my period. But yes, light exercise helps improve blood circulation, which can ease cramps and improve your mood. Now, let's bust some period myths. Have you ever heard that drinking cold water stops your period? That's completely false. Your period is controlled by hormones, not the temperature of what you drink.
Now, let's talk about ovulation. Ovulation is the release of a mature egg, which is the ovum, from the ovary into the tube called fallopian tube, where it can be fertilized by sperm. Ovulation usually happens around the middle of your cycle, about 14 days before your next period starts. But this varies for everyone. Here's how you can tell if you're ovulating. 1. Cervical mucus changes. Your discharge becomes clear, stretchy, and slippery, like rye whites. 2. Basal body temperature. Your body temperature slightly rises after ovulation. Tracking this daily can help you understand your cycle better. 3. Ovulation test kits. These kits detect the luteinizing hormone surge that happens before ovulation, helping you predict your fertile days if you're trying to get pregnant or avoid pregnancy. Tracking ovulation is key. Many apps also help track ovulation signs and predict fertile windows. And that's everything you need to know about your menstrual cycle. Remember, understanding your cycle isn't just about periods. It's about knowing your body and taking charge of your health. If you found this video helpful, don't forget to like, subscribe, and share it with someone who needs this information. Also, drop a comment below. What's your go-to self-care tip during your period? I'd love to hear from you. See you in the next video.